so we are now going to have Oshana demonstrate a side plank. So Oshana, let's just get into a side plank position. So when doing this exercise, the main thing is you want elbows under the shoulder, hands in line with the elbow. This is a great position to maintain stability. You want to engage your glutes, Oshana, so just make sure you squeeze your glutes, get your hips a little higher, okay? And what we want is heels, hips, upper back and head in one line. So Oshana, if you can just move your head back a bit. Yeah, so we want your whole body to be in one nice straight line, and we generally hold this position for no more than 30 to 40 seconds. Remember again, we want to be in one nice line, because when we stand, we do not have our heads tilting forward or collapsing backwards. We want a nice straight line, and we hold this position for 30 seconds. And one very important thing to remember, as you get into that 20th, 25th second, the hips tend to drop and you got to cue yourself to come up. All right, so when doing the side planks, a very common mistake we see with clients is they tend to get a little curled up when doing that exercise. The perfect technique is everything in one nice line. So this is a very common position we see clients getting in. They struggle to maintain a nice straight line when doing this exercise. So sometimes we try to correct this exercise by cueing them verbally, but if that doesn't work, a very quick fix is basically trying to get them to perform the side plank against a wall. So Oshana, you can just get down, push yourself against the wall, and what we would do here is heels, hips, upper back and head nicely pasted against the wall along with the elbow, and we would hold that position for 30 seconds. We would get clients in this position for 30 seconds, maybe in the first few weeks while training them how to do the exercise, and then after a few weeks, then we take them away from the wall. So this is a great way to create postural awareness when doing the side plank. It is critical that you maintain one nice straight line when doing this exercise. All right, so the final part of our course series is anti-rotation exercises. So we've spoken about anti-flexion exercises, anti-lateral flexion exercises, and now we're going to talk about anti-rotation exercises. As mentioned before, the spine is made for no more than 12 degrees of rotation. So the exercises we do here is going to actually prevent rotation, which is again great from an injury prevention standpoint of view and also from a functional strength point of view. So we are going to have Sharon perform the first progression to our exercise, which is a kneeling Paloff press. Very simple exercise. You just kneel. We just bring the cable to our chest, press out, and press in again. So we are shortening the lever and we are lengthening the lever. And we've got 4 points of contact here. We've got the 2 feet and the 2 knees. So we would do 5 repetitions of this on each side. All right, and the final progression to our Paloff presses is going to be a standing Paloff press where we go into a 2-point stance. Basically, now you've just got 2 points of contact on the floor, which are the 2 feet. And again, we follow that same routine where we press out and we press in. So let's have Sharon do a few of those. So some people who struggle to maintain posture in this position because the base is much narrow, then what we would ask them to do is have a wider stance. So Sharon, get a little wider, slight knee bend to make the exercise a little easier. So if you struggle to do it with a narrow stance, you could widen the stance and perform the exercise with a slight knee bend. Okay, so sometimes we have athletes, clients who have low body injuries such as knees, ankles, so they are unable to perform the exercise kneeling, standing or half kneeling. So a great way to still continue to get that anti-rotation core strength is just sitting on a stool or a box like this, and yet you can perform the exercise. But the key again is to stay nice and tall when you do the exercise. So let's go, Sharon. So this is a great way to continue to get some great core strength. If you're post ACL surgery, post ankle hip surgery, you can yet sit in that position and yet continue to work on that anti-rotation strength. Good.